Just want to introduce myself. My name is Jodie Wigfall-Coy. I'm one of the sexual health promotion advisors from Sexual Health Sheffield. And I'm going to be just sharing with you in this session a really brief overview of the team that I work with, the kinds of work that we do, and then with a bit of a focus on working with young people. So I'm going to share my screen with you, so just bear with me a second. Fantastic. Okay, so as I said, yeah, Jodie Wigfall-Coy, Sexual Health Promotion Advisor. I've been with Sheffield Teaching Hospitals for around 20 years in a couple of different roles, but predominantly with teenage pregnancy and sexual health. So just to give a little bit of information about our team. So we sit within Sexual Health Sheffield, based at the Hallamshire Hospital. And the health promotion team is made up of 3 of us. So there's myself, there's Ash Marshall, and there's Matt Harrison. So all of us are sexual health promotion advisors, and we each have specialist roles that we play, so responsibilities within the team. So Ash is responsible for our work with the LGBT community. He's responsible for patient experience, and he's also responsible for equal opportunities within the service. Matt Harrison is responsible for work with BAME community, for our HIV prevention strategies, including PEP and PrEP. And Matt is also leads on all our social media and website work that we do. And then I'm responsible for all young people's work, so working with the under 25s across the city and all other vulnerable groups. So between the 3 of us, we cover the city, and with a focus on those different areas. So a little bit about our team, for those of you that might not have met us before or have heard the work we do. So the health promotion team, our aim is to contribute to the development and implementation of strategies for promoting the sexual health of socially excluded, complex, marginalised and vulnerable communities, with a particular focus on those people disproportionately affected by sexual ill health and people living with or affected by HIV. We are responsible for the identification and the management of sexual health outreach, and all those initiatives that we do in a range of settings, utilising a variety of community engagement models, recognising and responding to the complex needs and sensitivities of a wide variety of communities. And we do that in a variety of different ways. In different communities that we work in, it looks slightly differently. So if we were working in a school, compared to if we were working with university students, compared if we were working in a supported accommodation site, or if we were working with primary care, or if we were working with an organisation that supports sex workers. So we use a lot of different sexual health outreach initiatives across the city. Another one of our aims is to promote the sexual health of the community through health promotion and targeted outreach work. And this does include online services such as web services, social media and app-based services. So we try to stay very current in the work that we do. So we do have a presence on different app-based services, where we will chat with people over web services, We do a lot of our work via social media, so we do a lot of social media campaigns, and that's outreach by kind of sharing different sexual health promotion messages, but also ways that people can communicate with us as well. And we work in partnership with a lot of organisations across the city. And we offer a whole range of ways in working with people. So we can offer staff training. So that can be very general staff training, or it can be specifics. So, for example, I can run training around working with young people, around contraception, STIs, access to pregnancy services, relationships. So this can help staff to feel more confident around working with young people and those really nice health promotion messages that we want to get out to them. We can also have presence at community events. So we will often get invited to different community days. We're often at a lot of the festivals. We work really closely with a lot of the community-based organisations, and we'll go out if they're having fun days or workshop days. We get involved in freshers with the university students. So we like to have a presence at community events. We provide sexual health information and signposting. So wherever we have a presence, we will always take resources with us where we can share sexual health information, and we can signpost into local services. We also produce a quarterly e-bulletin, which is all around the campaigns that we've got coming up for the next quarter. We also share national campaigns as well as our own local campaigns. We often will add in trends that we're seeing across the city, events that are going on across the city, and share good practice. We know that out there in the community, lots of people are doing really good work, and so we like to be able to celebrate that and to share that across the city. And as I said before, our social media materials for local and national health campaigns. So we can share and produce materials that can be used on social media. So our own social media platforms, so Facebook, Twitter, Instagram, but also resources that can be shared as well. So that might be that organisations will share it on their own social media platforms, and we will retweet and share things that organisations are doing as well. And we find that this way of working with the community, we try to kind of tick all the boxes in terms of what mostly appeals to each of those organisations. So if it is more staff training, is it more resources, is it signposting? Just in a question that's popped up from Cynthia, different languages. So our website, we have a widget on our website. So if you go on the Sexual Health Sheffield website, there is a box you can click, and it will change the whole website into a variety of languages. So yes, our web-based services do come in different languages. So that's a little bit about our team and the work that we do. And now just kind of focusing a little bit on young people's work. And you're welcome. And this is something that I'm really passionate about. I've worked with young people for a long time in a variety of different roles. And young people's work is something that I really like. You know, in Sheffield, we have a real diverse community that we work with within young people's services. You know, the broad spectrum of young people that we have. So we work with the under 25-year-olds when we're talking about young people. And there are lots of different ways that we do that. And one thing that we are really keen to do is to understand and respond effectively to the sexual health needs of young people across the city. And the reason we do this is because if we invest in young people's healthcare, we know that that can have a significant impact on young people. We know it can improve their access to services. We know it can improve their health and well-being and support behaviour change. We know that it can reduce health inequalities, and we know that it can reduce financial costs for the future. So there are around 10 million young people aged 10 to 24 in England, and that forms around 17% of the population. And we know that those young people will either now or in the future need to access health or care services. So for us, it's really important that we make their experiences really positive right from when they're young. You know, we often focus services on adults, particularly around sexual health. But for us, it's really important that we provide that really good experience for young people when they're first starting to look at their sexual health, their relationships, because we know that if we get it right when they're young, they feel more confident, they feel more empowered, they feel more likely to access services. And so we want to be able to understand and respond to young people's needs as they are presented. We know that access to services is different across the city. We know, for example, that Youth Clinic is based at the Hallamshire Hospital. And so for those young people who live and maybe go to school at King Edward's, it's fairly simple to cross the road and jump into the Hallamshire. Whereas if you go to school in Stocksbridge and you live in Stocksbridge, it's a good 45, 50 an hour journey to get into us. It's a 2 bus ride. And when you're 14 and you're trying to hide maybe from your parents where you're going after school on a Monday or a Wednesday, you know, that can be difficult. And so we know that trying to improve access to services and information for young people is really important. We know that improving health and well-being and their understanding of it and their feeling of being empowered around their own sexual health, we know that that can support behaviour change. We know that when young people feel able to access a service and access professionals who they can talk to and who they can trust, we know that young people are more likely to make positive choices, and those experiences can really support behaviour change. Where a young person might be making poor choices in terms of their relationships or their sexual health, we know that if we improve access and the service, that young people tend to make better choices for themselves. We also know that that we want to reduce those health inequalities because we know that there are disparities, especially for young people who are young carers, for those who are part of the LGBT community, for those who are looked after, for those who are part of an ethnic minority group, for those with disabilities. We know that there are inequalities in the way that they can access services. And so again, we want to understand and respond effectively to those young people. So what are the benefits of focusing on young people? So the services that give young people the confidence to trust, to access and help and support when they need it. Again, one of the top things that young people say that they want from a sexual health service is to know that it's confidential. That is really important. I think for anybody accessing any service, we want that guarantee that our information is confidential. And I think there's an additional layer for young people, particularly around sexual health, that they want to know that it's confidential, that we're not going to be sharing their information with anybody. They want a non-judgmental service delivered by approachable professionals who understand and can respond to young people's unique needs and challenges. We know that young people worry about what professionals think of them, and can sometimes struggle to access services where they don't know the adults that they're going to be speaking with, and they want to know that they can build that relationship. So, they want to be able to build a non-judgmental, trusting relationship. They want to know that you know what you're talking about. And so particularly in primary care, where a young person will maybe know you for lots of other different reasons, they want to know that they can come and talk about sexual health with you. And maybe they might not have the confidence or the emotional language to be able to come and explain that or explore that with you. And they want you to ask them as the professional, is this something that they would like to talk about? And also the improved local information about young people's perspective, good practice, and opportunities for innovation. One thing that our team are really, really good at and we're really keen at is that local information, that we're sharing information with young people. So it's not only about the services that we deliver, but also local community services. So when I go to schools, I'm really keen to know, who are the local GPs, who are the local pharmacists, who are the local youth workers, who are the local community-based services. So I can go into a school and talk about sexual health and talk about all the services that are available for that young person. And as I said earlier, particularly in those communities that are not able to readily get into a youth clinic, those that are kind of on the outskirts of the city, we want to be able to share all the local information with young people, so they have got they can make those informed decisions and choices about the service that they would really like to access. So how do we do this? It's like a whistle-stop tour. It's how do we do this with young people? So these are the things that we know young people have said. So involving young people in their care and the design, delivery and review of services. So in primary care, in your practice, it might be that you find out from your patients, from young people, about what they would really like from your practice. What would they like to be able to access from you? Is it just information? Is it services? Is it somebody to talk to? Is it that they can drop into a practice and pick up some information, some leaflets? Is it that you will signpost them into other services? And it's about involving young people to find out what it is. You'd be amazed how young people in one area will want something very different to young people in a different area. And that changes as well over time. So really asking young people what they want, asking for their feedback, explaining confidentiality and consent. Again, I said this earlier, this is something that young people talk about a lot with us. They want to know what your confidentiality policy is, particularly in relation to under 18s, under 16s. And they want to know about consent. This is really important to them. And so, it's working out how you maybe as a practice communicate that to them. Is it something that's on your website? Is it something that's, in your waiting areas? Is it something that is explained to young people when they come in for appointments? Making young people feel welcome. It's a bit of an obvious one, but again, it's it starts right from the beginning. When a young person walks into a practice, do we have a reception team who are welcoming to young people? Does that welcome kind of work through the whole practice? Is the waiting room appealing to young people? Do young people see themselves in that waiting room? Are there bits of information there that are young people specific, young people focused? Um, is there a way, again, that a young person can communicate to the receptionist what they are here for in a way that is helpful to them? I know some practices have those really lovely little cards that are just kind of slid across the reception, and a young person can point to what they've come for in case they don't feel able to explain, in case they're worried about other people around them hearing what they're there for. So it's about you thinking, how can we make young people feel welcome in our practice? Providing high quality health, well-being and care services. This is something that we all strive for all patients. This isn't necessarily specific to young people, but if we were to think about specifics for young people, what would that look like for them? What would those high quality health and well-being and care services look like from a young person's point of view? And how can we really make sure that we are focusing on young people within that? Young people love the digital approach. We know that a lot of young people will, their first kind of interaction with sexual health services is to look on a website, to look on an app. They will be looking on your practice website. So it's not saying that we think that all practices should have you know Instagram and TikTok and all that kind of stuff. Although if you want to do a TikTok dance around sexual health, you feel free. They would love a bit of that. But it's about kind of what your website says to young people. Because a lot of the time in schools we will encourage young people to access their GP practice around sexual health needs. So is there something on there that tells a young person if you do implant fittings, or tells a young person that you are welcoming to them and their sexual health needs? A lot of the time they will want to know, will you see me without my parent being there or my guardian being there? So just a little bit of thought around that digital approach. Do you have text-based services? I know we work with some GP practices and we put out kind of text messages to young people, just kind of saying to them, have you recently had a chlamydia test? When we're doing our campaigns, we can send links to practices that you can then forward on to those in your practice that are under 25. And we can absolutely work with you to prepare the kind of wording for that, if that's something that you would want support with. We also do staff training, so staff skills and staff training, and this can be for a whole practice, or it could be with your reception staff around how to engage young people. It can be with practice nurses, it can be with anybody in your practice, just looking at how we really communicate those really nice, positive sexual health messages to young people. We'd also, love to link in with you. So we encourage communities to really work in linking in. So it's finding out what your local services are. So who's your local school, your local pharmacy, your local youth provider? And actually, if that's something that you're interested in, I can help with that. We map out all the services across the city. So if you would like me to kind of help you out with that piece of work and link you in with local services, that is something that I can absolutely do. And then again, just recognizing that young people's needs change. You know, they change a lot, and so it's really supporting that change. Talking to a 13-year-old is different to talking to a 16-year-old, different to talking to an 18-year-old. We know that their needs change, and so it's as they grow up within your practice that we look at supporting their changing needs. That has been an absolute whistle-stop tour of the team that I work with and sexual health services and young people. These are my contact details. If people want to get in touch to chat through anything that I've talked about, anything that I've touched on today, or if you're wanting to know a little bit more, I'd love to hear from you. Love to work in partnership with you. So please feel free to get in touch. We've literally got 2 minutes left. Any questions that anybody wants to fire at me now, and again, really happy to answer questions if you haven't got time and want to email me afterwards.
You did get a question in the chat, Jodie. Could you take the clinic to places where young people go, like Meadowhall?
Say that again, sorry, James.
Could you take the clinic to places where young people go, like Meadowhall?
So yeah, do you know, it's we do. So we've got a clinic at the Moor Market, and then we also are absolutely open to the conversation around where else can we provide services. We obviously have to think, if it's going to be a clinical service, about the setting, making sure that it's a kind of appropriate settings. But we are open to conversations around what that potentially could look like. We have delivered services in all sorts of different places. So yeah, if that is something that people want to explore further, it is something that we can absolutely talk about. Yeah.
There was no more questions added in the chat, so I guess it's good time for everyone to jump onto the next talk.
Fantastic. Thank you so much, everyone, and I hope you enjoy the rest of your day.
Thanks, Jodie.